Hello again. As promised, I came back to you for the rest of the story. Uh, as I mentioned, after passing like hard examinations and assessments, um, I started to work at Jupiter Health Womboro in the city of Rockingham. Jupiter Health Womboro was established in 2018 by Dr. Gandhi, the owner of Jupiter Health and Medical Services brand. He owns 60% of this practice and 40% of the practice owned by two Iranian doctors, Dr. Rachel or Rahele Hadipur and Dr. Mike or Dr. Mohammad Marashi. They are husband and wife and they own 40% of the practice. Dr. Rachel was my supervisor and Dr. Mike the clinic principal. I know them from university days. Some information about the practice, the area that I started to work, and the community. As I mentioned, I live in Rockingham. Rockingham is not a very fancy area in Perth. According to some people, even it might be a notorious area for some reasons. But honestly, when I started to work in this area, after 3-4 months, I really liked it because that was very easy for me to be connected to people, to my patients. That was actually the most important thing for me, to be able to interact with people in the best way. And actually, the area is quite beautiful. And another matter that I think had a very big impact on my impression, my positive impression about this area is that I rented a place, an apartment in front of the sea, and I have had two lovely landlords, Adam and Kingsley, and having them, they are Australian, from the Australian community, so that was another reason that I was seeing the local community, a community that I like to interact with. Generally I found people here very welcoming. Starting to work in a new area, even in a suburb, for me it was a new country, a new continent. It's always challenging, as you know. When, as a doctor, you start to work here in Australia, you have to deal with things that you never had any idea about them. Because whatever we do in the process of assessment, examinations, and those sort of things, it's about getting familiar with Australian medical setting or health setting. But when you start to work here, then it's different because you need to start to realize that what is actually Australian workplace setting look like, or what kind of businesses actually are engaged in the work of a medical doctor, and each practice even might have a bit of different approaches. And then instantly you will be required by your employer to, like for example, establish a new bank account or tax file number, and some employers even ABN. They will ask you to have your ABN established, and Medicare, dealing with Medicare, and also indemnity, which is like indemnity insurances that are supposed to protect you in terms of your liability. If you do anything as a doctor, if you do anything wrong, and also they're supposed to provide you with advice about your rights, your workplace rights, and your, your rights as a human being even. And so basically that is an important matter that you need to take care. Yeah, these sort of things would be initial challenges, and also seeing patients and talking with them with English, in English language, which is not your, for some of us it's not our like official language in our countries. But still, with all of those challenges, I found it quite interesting, and I started to like it a lot here. Mostly because of people, and also because of weather and the unique environment. And and it was not just me that it was also my wife Marjan that started to love the area, and like, it took me like maybe 4-5 months to reach to this point that I just want to stay here. And although like some other doctor colleagues, they say that you need to move after having more money to more fancy areas of this city, I was thinking, no, why? There's no reason to think in that way while I'm happy here working and living in this area. And yeah, these were mostly my initial impression as a doctor, and I was enjoying working here. And although some problems started to emerge even from the initial days of work, still predominantly I was enjoying it. And then we kind of faced pandemic, COVID. Yeah, after a few months of working, as you know, actually COVID-19 came here. And the whole world has been, the whole world, the thing that has been there over the past 2 years, and unfortunately, the whole world is still struggling with this phenomenon. But you know that in WA, in Western Australia, somehow condition has been quite different, and I need to say that when comparing conditions with other states in Australia and or even other countries, you see a huge difference between the quality of life and condition of the society in any regard, like economic or health. There is a huge difference here. And I need to say that that was the excellent work of the state government here. And you can see that the lives of the people matters here for the state government of Western Australia. As a doctor, I've been seeing it. And when I compare it to like other countries, even the condition in my home country, Iran, unfortunately, many of my friends and family members, they have been affected by COVID, and I even lost a couple of previous colleagues, doctors. But here we have been able to have a normal life, near normal life, and we had the privilege, and I believe that we need to be grateful for that. And yeah, we just see, even in other states of the Australia, I have friends working nearly in each state. They are not, they haven't been able to like live normally for the most of the times over the past 2 years. Just this, if you like simply just think about working with a mask all the time, which has been there for some states for medical doctors. It's really frustrating. Apart from the physical hardships of it, you cannot even be connected to your patients, and that's another problem for a doctor. But that's necessary when you are facing this dangerous virus. You need to do that, but that's a very hard life to live. So I believe that we need to be grateful for what we have here and just put more effort to be realistic and to keep it in this way, and also to help others in other places that they are struggling with high mortality rates or more limitations in their daily lives. And one of the biggest help is vaccination. So back to my experiences, yes, these were my experiences of starting to work in this area. And I'll get back to you soon. And hopefully next session, I really like to talk about practicing medicine and the way that GPs, like doctors that are working as a GP here in Australia, they can make a change in their patients' lives, because I've been through those steps, because I love to work comprehensively for my patient, and I have been always seeing my patients thoroughly. So that is going to make a difference if you try to see your patients properly and according to guidelines. We have all of those approaches in the Australian guidelines. Okay, so I think that's enough for today. I'll get back to you soon.